Welcome to Insured Solutions in our ongoing series of going on offense with workers' compensation. Today, we're going to talk about a drug and alcohol program and the importance of having a program in the workplace. It is amazing how many employers do not even have a program or misunderstand what a program is versus a policy. It is important to deal with workers' comp in the context of a drug and alcohol system because statistically 60% of the claims in workers' compensation have some connection or involvement with drugs, be they illegal drugs or legal drugs used illegally. We're going to talk about a written program and why you need one, and we will provide you an outline of one that will serve the purpose that you need. Here is a written drug program that we at Insured Solutions have been using for years. It's very effective, it's simple, it gets right to the point, and it covers all of the elements that have to become part of a program, not a policy. If you'll look at the first page, you'll see it talks about a substance abuse policy statement, which is distinctly different from a program. A program provides mechanical direction through the process, defining the ways testing is done and the different parts of testing, including what to do for an alcohol screen and/or what to do if someone refuses to take a drug test. If you'll look at the first page, you'll see the substance abuse policy. You go to the second page, you will, as the employer, have 5 days to respond for a failed drug test in writing to the employee should they fail it. You send a letter in the back of the program by certified mail, signed receipt requested, and they're notified of the results and the consequences of failing the test, which are pursuant to the program. If you go to the next page, you'll see in the middle the cause or suspicion elements that define 6 particular areas where your supervisors need to be aware of what they're looking for if they have some reasonable cause or suspicion to do a drug test. The drug test then can be ordered based on one cause or suspicion and backed by a supervisor. There's not a lot of training involved. It's not rocket science, but you need to have a fundamental reference point when you're going to do a drug test, and this will provide that. The program itself, when you go through it, will cover all the elements: the pre-hire testing, the post-accident testing, the random testing, and the cause or suspicion testing, all 4 elements. A state certified program typically requires you to do all of these. You don't need a certified program in particular. You need to do the main elements of testing, which are the pre-hire, the post-accident, and the cause or suspicion. Random is a relative thing depending upon your workforce makeup and whether anyone has been tested at all. What you'll find with a drug program is you're sending a message, and as you know, everything we at Insured Solutions do when it comes to controlling workers' comp is a behavior-driven matter. The drug program sends a message. It protects you. Just know that if you do not have a written drug program, you're going to attract all the other applicants who have been tested and failed at other locations, and they're looking for a way to get on someone's payroll, and they will do so unless you test them. So the odds of one finding you are much higher unless you do testing. Now, testing can take several formats. Many companies like to use a laboratory. They want to send out for a lab test, and that's fine. What we prefer is the saliva drug test kits that you can find online at reasonable prices. There are several that have great prices on these, and they're very sophisticated. The advantage of a saliva test is up front during an applicant phase. You can either pay for the drug test, put them through the drug test with the saliva, which gives you a response in about 10 or 12 minutes of a reading with a chart. If it's clean, they're ready to go. If it's not, it's reject. Or you can say, and we have accounts that do this, put a $10 cash deposit up, refundable only when you pass the drug test. If you pass it, here's your money back. If you fail it, I'm keeping your $10 and I can't hire you. Case closed. Or you can pull what we call the ploy. You can simply tell the applicants, look, sometime in the first 7 days of working here, we're going to call you out unannounced and we're going to do a drug test. And we'll go from there to see what happens. The thing is, you never do it and you never bring it back up. And what you'll find is those that have problems will be suspicious they're going to get caught once they get on, and then a lot of times they don't come back anymore. So you've weeded them out at zero cost, at a $10 cost, only on those that pass, or at the full cost. You can work the range depending upon how you're set up as an operation. The drug program will give you definition, but it is only for the drugs itself. Backing up a drug program, we also need a prescription drug program and an over-the-counter drug program. And here you'll see what one can look like. It's very generic, and it's one that will cover the 2 issues and put balance in it. Surprisingly, 50 million Americans, which is a high percentage, have some form of prescription drugs involved in their life, and that's understandable. About 5 million are taking prescription drugs that aren't even theirs, and they're taking them beyond the way it was prescribed by the doctor because they become addicted. This leads to workplace problems as well. So prescription drugs is a key concern. If you go back to the page 1 of the drug program, item number 3 talks about prescription drugs, and you definitely need to stay tuned to that. Be aware of that. Over-the-counter drugs can be problematic for some people who are sensitive to drowsiness. They can take some antihistamines, make them drowsy. Certain work environments are much more dangerous, and you need to have a lot more of a handle on the type of drug being taken, over-the-counter, prescription, or illegal, either way, and you need to take action accordingly. Sometimes job descriptions have to be changed. You can't have someone on drugs in the workplace. Workers' comp, as you know, is no fault. It's up to you to go on offense and preempt the subject out of the gate. That's an imperative part of it. Now, in closing, we want to remind you that these programs will be made up, customized for you in your company name, provided to you with guidance and coaching on what to do, how to do it. If you have questions, you can call our office. You can ask for me or one of the field reps. We'll be glad to assist you. And I thank you for taking the time to watch this video. See you next time.